And that's a big balance, because I think that an oncologist would appropriately be upset if there was no communication with them and then you place this person on hospice and there's no discussion, there's no inclusion. I think that a lot of them would get very upset. And at the same time, there are some that are very aggressive.
Remember, though, like I started it out with, there's a difference between hospice and palliative, and we're not necessarily putting all these people on hospice. Just having palliative care following along with this patient who has a documented terminal illness, who can be there for counseling and for pain control. All right, these are pain control experts as well. And as Dan said, they live longer. So I understand where onc is coming from. You start to take away hope. You really are taking away a major foundation in the fight against cancer. I know they don't want to do that. But at the same time, I think palliative care being involved is not a nit of defeat. It's just having an extra physician there that's focusing on your care.
And as Rich points out, a consult to palliative care does not end in hospice every time. Sometimes they evaluate the patient and say, actually, we think that this might turn around. We're going to continue to follow along. And then in 3 months from now, if they get super sick and they land an inpatient thing and they're dwindling down, then it makes it much easier to change course than if you wait until the last 72 hours of life and try to put them on hospice. That's kind of pointless. Like it doesn't make nearly as much sense as getting them involved early.
I just wanted to add one little nuance to something that Richard started on with the discussion about quality of life. If you will also, as you're talking to the families, don't approach it as DNR, do not resuscitate, which basically suggests that you're taking something away. There's an older concept called AND, allow natural death, and most folks will jump on that. That's what I want. Just let me go peacefully, let me go naturally, without all the heroics. So you're not taking something away, you're allowing the normal process to go forward without feeling the part about, do you agree if we just withhold this other stuff? We just want to bring that on the table.
That I think is a much more appropriate framing of it, along with we're being maximal in our palliation and making you comfortable. That's how we're being aggressive. Not that we're turning down the knob of how much we're caring about your loved one. It's just that we're changing the goal, as Rich mentioned.
My question, I guess, goes towards as far as when you're in a case with another service whose goals are maybe not as aligned with yours. How aggressively do you broach this as far as resuscitating this type of patient if you don't think this is an appropriate patient to be full bore go full bore in resuscitation?
Yeah, that's a sticky picture because it's you're in the heat of the moment in an acute resuscitation, and do not resuscitate, I guess, can have a lot of connotations to it. If the patient is here with contractions and contractures and no quality of life, DNR seems like an easy decision. However, if they have a bleeding spleen that can be fixed with an intervention, maybe they do want resuscitation. So I think the water gets really muddy there. I would suspect that if you're finding out that they had a living will at home, you would have family there. And I think that I would get very specific about that. I'd be like, listen, they potentially have a treatable condition. Would they still want resuscitation at that point? It's conceivable that they could survive this injury. Do they still want aggressive resuscitation, do you think? Yeah, that's putting some decision making on them, but it's a question that needs to be asked, I think. In terms of if the final decision is made that the patient has specific wishes, you have to follow those wishes, whatever the case may be, assuming they're not, suicidal or something. It wasn't self-inflicted injury. But yeah, you have to follow their wishes.